On a scale like of 1 to 5, 1 being like it's a huge pain, and 5 being like it's why I wake up and get out of bed in the morning, where would you put the running of the classes? And also, let's go back and talk about the documentation. And then I'll ask you the same question later for the last activity.
And 5 represents?
5 is like super awesome. 1 is like you hate it. It sucks.
Well, to be frank, running the classes, I really enjoy the interaction, and I really enjoy the time I spend with the patients in the classes. Of the class and have to go sit down at a computer and do the documentation, I'll give that a 1 or a 2. That's not so fun.
Okay. Okay. And is that strictly because you're I don't want to put words in your mouth. Why don't you tell me, like, why is it that you give that the score that you gave it?
Well, because the computers that we document, the desktops, because it's a psychiatric hospital, the computers have to be in a separate secure location. They can't be out amongst the patient environment. You have to really maintain a very safe, clean patient environment without risk items like computers around. Get someone who's angry, they could knock one over. So I have to leave the unit and step away from it. So that kind of hurts staffing because I'm no longer there to contribute. I'm documenting. On top of that, documentation, it takes me away and it takes time. And in Epic, it's tedious because it's not just one screen where you type everything up. It's a series of multiple tabs to talk about participation level, affect, what were their comments, did they come in late, or all sorts of things, and then to talk about what material I presented and all sorts of things. So it's not linear, and it takes a lot of time, and it takes me away from my patients.
Okay. The questions that Epic asks you, are they a series of like yes or no questions, or do you actually have to, is it like a paragraph that you type in? Like what kind of form does the data take? Or is it a mixture of both? Okay. Okay, and I assume, I'm going to go out on a limb, but I'm thinking that you're not going to answer the questions unless you, like there's no optional questions on the form, right? They're all required questions.
Yeah.
Okay. So there's okay, that makes sense. So you make your rounds, that's one set of documentation. You conduct your classes, that generates a second set of documentation. Is that correct? Okay.
Yes.
And then when you combine those two documentation steps, it totals 10 hours a week. Is that right?
Right.
Okay. Which of those types of documentation is more annoying, or are they both equally annoying?
Well, I would say entering the vital signs is more annoying because a lot of us feel, I mean, a lot of myself and people in my role, if I can speak for them, is that it's the manual entry of it is unnecessary. There's got to be a way, or there should be a way, that if we take the vital sign at the bedside, for it to, if it's in a computer, if it's in the vital sign machine, it should just go into our system. We have Wi-Fi. There's no reason why it can't hook up. Meanwhile, so if I get a blood pressure, a temperature, respirations, blood sugar, all sorts of things, I get all this data, I write it down, then I got to go to my separate place away from the unit and manually enter it, each thing on a different screen. You know, that becomes time consuming and again takes me away from the unit. And we feel that those kinds of things, you know, if I write a paragraph about a patient in group, that's subjective. That's me entering my opinion. But vital signs they're objective. It's the number that it is. And that kind of data should be able to directly go into the patient's chart without manually entering it if we're going to be the most efficient we can be. That's how I feel.
If you look over your entire like 40-hour work week and you compare the problem that we've been discussing to other very specific problems, where does this fall on the spectrum in terms of severity? So while you're thinking about that, one question that I sometimes ask during these interviews is, if you could wave a magic wand over your job and sort of fix like one specific problem that you encounter, which problem would you pick?
I think that would be one of the top ones, not necessarily because it's so inhibiting of the job and it ruins every day, but because the possible benefit of letting staff spend less time documenting and more time with the patients by the bedside or in their environment is a huge benefit. We've been doing things for forever that we don't perceive it as that huge of a problem. It's just how we're used to doing things.
It's
But
just
when you consider the benefit, it could be huge.
okay. It's just kind of the way things have always been, so to speak.
Mm-hmm.
Okay.
But when you allow the caregivers, when you allow the nurses and the techs to spend more time with the patients in their environment, all sorts of great things happen. Patient satisfaction scores go up. Patient care improves. Patients can get better or move on to their next part of their treatment faster. I mean, that much of that has been documented. You know, the more time spends with the patient, the better things go.